Hey everyone, and welcome to the Let's Talk About CBD podcast. Plant medicine is a gift from the earth that we're constantly learning about and rediscovering. CBD and its sister cannabinoids are gifts that have helped people with their chronic pain and ailments. I am seeking to show the world how CBD has helped people overcome the pain that they're dealing with by giving them this platform to talk about how True Natural Oils Inc. has helped them live better lives. Today, we have Robin McDonald, who is the pharmacist and research and product development specialist on our team, here to talk to us about her role in True Natural Oils Inc.
Hi, Rylee. Thank you so much. That was a wonderful introduction. I am so happy to be here with you on Let's Talk About CBD podcast. I really appreciate this platform because just in knowing what I know and what I've discovered about CBD, I'm just excited to share with everyone today. So thank you.
Oh, I'm so
Let me
excited.
Thank you. I'll take a moment to tell you about me. So, my name's
Please.
Robin McDonald. I'm a pharmacist for 31 years. That just dated myself, didn't it? So, yes, I've enjoyed,
It gives you credibility.
yes, but I've enjoyed a wonderful lengthy career in being a pharmacist, and I have taken a role with Natural Oils Inc. as their pharmacist on the team and research and product development specialist. So that I take great pride because I really do dive into the articles. You'll see in a bit, I have some outlines that I wanted to share with, it breaks down how I do the research and kind of how I come upon finding all of this rich information. So I'm excited to bring that to you.
Thank you so much. Yeah, I know a lot about you, but our audience does not. So thank you so much for that introduction. Um,
Yeah.
I would actually be really curious and like to talk to you about how you got into pharmacy. I know a lot of women are not involved in the sciences, and personally, I'm really happy that our team is mostly women run and that we have a female pharmacist on our team, and it just makes me so happy that we have that backing. And I would love to talk to you about your pharmacy background and how you got into it.
Yes, I'd love to talk about that. So, back in the 80s, when I went to college, yeah, I have to say that there were not a lot of women at that time that wanted to go into the sciences. And at least what I experienced, I went to college at the University of Pittsburgh School of Pharmacy in Pennsylvania. And yeah, back in the 80s, there was probably about a 40 to 60 female to male ratio of my school, my classmates. So it was a very exciting time. It was, it just getting into the realm of pharmacy was exciting for me. A little background, I guess I'm a little bit atypical because I didn't wake up when I was 12 and say, oh, I guess I'll just be a pharmacist one day. It wasn't that way for me. So I worked at a local drugstore as a cashier. And I just really observed what was going on. The very knowledgeable pharmacists that I worked with at the time, I saw that we were able to help people to, provide vital medications for them that just really produced incredible outcomes in the way that they got through their ailments or, managed their chronic disease states or whatever that looked like. I knew that I wanted to be a part of it. So I think I remember just, when it was time to graduate from high school, I told my parents, I said, yeah, I think I want to go to pharmacy school. That it sounds very interesting. I had no idea what was entailed. I had no idea how difficult it would be, but there I was. My dad helped me with my application to pharmacy school. I was accepted right away, and there I was, off to Pittsburgh to study about this wonderful profession. So I feel really blessed and really very grateful for having such a wonderful, lengthy career. So that was how I got started in all of this.
Yeah, that's actually really interesting. I didn't really know that about you. Um, I would actually be curious now to hear what motivates you to keep working in the field.
I guess I'm the lucky one of the lucky ones that I've always enjoyed my career. Not everyone can say that. 5, 10 years down the road, you get into your career and you hit a rut, or you discover that things weren't as the way that you thought that they were going to turn out.
Mm-hmm.
It's been quite the opposite for me. I've practiced and been in or held a license in 3 different states: the state of Virginia, the state of Alabama, and now the state of California, which is definitely the most challenging. So I've, I'm glad that I'm still able to continue the practice of pharmacy, to help people, to bring them wellness, just to see how they progress and how to help them, really is my main focus. And I can extend that to the practice of pharmacy, and I can also extend that to what we're doing now in
Yeah,
Natural Oils Inc.
I see
Um,
that. I feel that energy a lot from you. We're just wanting to help people. So
I
thank you so
do.
much for sharing that.
Thank you.
You're welcome. I actually want to talk to you about how CBD came into your pharmacy career, because it looked like initially a lot of pharmacists were shying away from CBD because it was so controversial, which I understand how that can be controversial for working with these plants in the world of pharmaceuticals. And I really, truly applaud you for being a woman that can balance both worlds. Um, but yeah, I just wanted to talk to you about how you approach CBD and what that journey looked like for you.
Oh, it's so interesting. I have one person to attribute to it, to my interest, to getting me started into the curiosity of what this gorgeous cannabinoid is doing for the body. But first, I'll tell you just a little journey back in years. Before 2018, before the Farm Bill was passed, CBD was just like, it was an off market topic. Nobody wanted to talk about it. Very few people understood it. There was a lot of myths behind it. And a lot of people, like you mentioned, Rylee, they were just really afraid to just approach the subject because, I mean, for lack of a better description, they just didn't have the education.
Mm.
So, and I did some research before I started with Natural Oils Inc., and we can cover that too, how I got involved in the company. But before I even started, I placed a telephone call to the California Board of Pharmacy, and I spoke with one of the lawmakers there on the board, and I said, I have this fascination and interest in cannabidiol, and I would like to know what my parameters are is for someone that holds a medical pharmacist license.
Mhm.
To what are my parameters? What are my legal restrictions? And I remember that nice lady telling me, she says, well, you know that CBD is still considered a class 1 substance, which has a class 1 substance is in the it's in the frame of, or the classification of, this is terrible relevance, but cocaine,
Mhm.
let's say.
Yeah,
So
heroin, like
yeah,
all those crazy
exactly.
ones.
Yeah, it holds a classification that has no medical use. So, and that's deemed by the FDA. So, I said, well, I simply want to do research on it, and I just, really want to know my parameters. So she's like, absolutely, you can research it all day long until the cows come home, as they say. But so I knew my place. I knew my place well. I, respect my profession and, of course, my licensure.
Mm.
And so I knew right then and there that I had my boundaries. So research it was. And once I dove in, I couldn't come back. It is so fascinating, Rylee.
Mm. Yeah, I mean, that's what I was speaking on with your heart. Like, you just want to help people. And I think from what we've talked about, you get so excited when you research these things and you're like, oh my gosh, I just read it could help with this, and I read it could help with this, and they're doing clinical studies with this. And I just love that, because most of
Yeah.
the time you really think of like people who study CBD being like hippies, or like holistic wellness being, shamans and stuff like that. But to
Mhm.
hear that there's a pharmacist dabbling in the world of cannabidiol is just, I'm just so grateful to have you on our team.
Thank you. Not to get us off track, but I just in the mail received an email from this organization that has put together a team of people to actually educate pharmacists in the
Yes.
realm of CBD, cannabidiol, cannabis, how it relates to modern treatments, different ailments.
Mm-hmm.
Um, as I mentioned before, I have to be very careful in how I treat all the research, and so
Mm-hmm.
my focus is on the cannabinoids of the cannabis sativa plant, not not cannabis. I do have to. That's one of my boundaries, is that I can't be involved in that. So we'll taking that forward. Yeah,
Mm-hmm. Of course. Yeah, and
that's
we're
important.
really respectful of that as a company. We have all legal products, all lab testing. We have zero THC. The, we're in the legal spectrum of
Mhm.
legal production. So definitely want to throw that in there for you.
Yes,
um,
thank you.
yeah, can you talk to us about how you stay so up to date with your research?
Absolutely. But before that, I
Mm,
talk about my research, I wanted to kind of outline for you how I was introduced to CBD and
mm,
how it related to my practice in pharmacy. So it's a terrific story. A wonderful woman that came to my pharmacy as my patient, and I was filling medication for her. She she has angioma, heme
mm,
angiomas on her brain and her brain stem, which actually causes her to have seizures. So, without going into a whole lot of detail, she had to research, since she was having repetitive seizures every time that there was a change in cranial blood pressure. It was just really incapacitating for her. So she did some research, and somebody approached her about the use of CBD
mm,
and how that has a lot of, it claims that it can help epilepsy. And certainly there's a medication that was launched, I think in 2019, called Epidiolex. And that is a prescription medication, an FDA approved prescription medication for people with seizures. There's a specific category of people with irretractable seizures, but I won't go into the specifics. But just to let you know that, so she heard that this CBD, this mystifying subject, this mystifying substance was eliminating the seizures. So she tried it, and she came to me one day and she said, can I talk to you? So I went out to the counter and we stepped over to the side, and she says, I really have to share with you my journey of how I've been using this product, and my seizures have nearly eliminated. She was so happy. And she said that she wanted to actually speak to her doctor about decreasing some of her seizure prescription medications, which she ended up doing. She still continued to take the CBD. And as of today, now that was back in 2017, and as of today, 5 years later, she's still seizure free. And, matter of fact, she's done interviews with the company
mm,
that she uses, their product, and she just brings such light and
mm.
information on the subject, to the whole realm of CBD and how it can be literally life changing.
Wow.
Yeah. It's incredible.
I know. I'm
So,
so touched by that. Thank you so much for sharing that.
oh yeah, yeah. She really just piqued my interest. Just to be able to speak with a real life person, which I had filled her prescriptions for years at that point, and I saw what she went through and the struggles and how it affected her family,
Mm.
and she and her husband, and it just there was so many different points of struggle for her with her blood-filled brain tumors, essentially, and how it affected her seizures.
Right.
So when she found a pathway to be able to eliminate that, it was truly very interesting to me. So that's how I started my research.
It's so beautiful. Thank you so much for that. I actually had a question in what you were talking about. You mentioned there's a drug on the market called Epidiolex. Is that a CBD based product?
Completely CBD. It's a very pure form of cannabidiol that they have out on the market. It was launched, well, it was developed by GW Pharmaceuticals, and I knew about it long before it came on the market. That's how exciting it was. And they finally launched it, I believe, in 2019. And it's um, in my opinion, it's a terrific medication, especially if you know a little bit about the story of, let's say, Charlotte, and in Charlotte, and I'm referring to Charlotte's Web. There was a little girl that just suffered with a seizure disorder. That her seizures, she would have 200 seizures a day sometimes, and so through many trials and many persistent, findings from her mom, I believe it was, or her parents, they
Mhm.
discovered that this extraction process of the cannabis plant was actually controlling her seizures, and that's how that company was born. So, I'm not endorsing Charlotte's Web in any facet, but it is a very noteworthy story, and it certainly played a part in um, how I approached my research. So,
And I'm sure how you developed our products as well.
absolutely. Yeah. Yeah. So I think you had asked me a little bit about
I
how
I
I
did. I wanted to know how, because you're always sending me all these, like the article that you mentioned, about them training pharmacists to be versed in CBD. But I would like to
yeah.
know how you stay so up to date with your articles and your research, because you're always sending me things that are so fascinating.
Thank you. Yeah. So, my husband and I, we live here in Newport Beach, California. And of course, there's a beautiful local library. So, back in 2007, literally, I went to the library, used their, um, location services for different articles. And he said he noticed that I kept coming to the library all the time. And one of the people that was helping me said, since you have your library card, there is a database online that you can have access to at the comfort of your home. And I'm like, oh my goodness, why didn't I know about this, weeks ago? So now the way that I did it then, and still continue to do it, is to access our Newport Beach Public Library. I go into the database of the branch, so the online services. There's a specific scholarly journal tab that I click on, I sign into, and then I have the whole database of information just at my fingertips. So the way that it works is I could simply sign in, and in the search bar, I could type the words receptors and cannabidiol. And matter of fact, I did that this morning. And so I did that. And there were, looking at my notes, there were precisely 19,000 results just for the words receptors and cannabinoids. I think I said cannabidiol before.
Yeah.
So and to follow that, so what I typically do is I go down, there's a filter section, and I will just click on the filter scholarly journals, and that narrows the search. So that, for instance, there's a whole compilation of data that's available in the library database of people that have submitted thesis and papers and newspaper articles and books and all sorts of publications. But for my research, I very much focus on just the scholarly journals. I just want journals that are, like, say, the International Journal of Molecular Science, the New England Journal of Medicine, those very highly acclaimed, very clinically specific journals that I can extract the information from. And not only does that make it so that I know that my research that I'm doing has been vetted, I guess is a word to say, but if these articles and these publications are publishing these articles, that they are the exact truth and the
Credible
most current
sources.
science. Yes. So that's exactly how, and it makes it very interesting because someone from our website or someone, just one of my friends or maybe a friend of a friend, will, they'll come to me and they'll say, I would really like to know more about my arthritis pain in my knees, and how is CBD going to help me with that? So I can come home, I can come to my library access, I can type in arthritis pain, knees, and cannabidiol, and then I guess another 10,000 articles come up. So that's exactly how I do it. So
yeah, we've seen that a lot. Like in our company, we have a lot of people who approach us asking those questions, like even for their pets, like, hey, my pet has this issue. Can you help me figure out what's the best thing to do is? And if I'm not incorrect, I think that's what has prompted you to develop each of our specific products. Yeah,
yes.
I actually wanted to speak on how you were able to incorporate your research into developing our products, and then also how you developed the products for yourself.
Yeah, so very interesting. So in all the research, it talks about, first, it's really important to understand what CBD is and how it's working in the body, not just from, a very broad thought of it is, oh, it's this oil. They tell me to take it. They tell me I'll feel better. Oh no, I break it down so much further than
Mhm.
that.
Yeah,
Oh,
terpenes, the whole profile.
exactly. So I have a really wide understanding of the endocannabinoid system that all mammals have in their body. I, have a molecular and almost like a neurological understanding of what the two CBD, well, there's more than two. There's CBD receptors that are something that is present in every tissue in our body. Depending on what tissue it is, it will depend on what receptor that we're speaking of. So I have a very wide understanding of what it is when someone comes to me and says, I just can't get my asthma under control. Can you recommend something? And, I know that in the lung tissue, there's, particular CB1 receptors that are going to be affected by cannabidiol and how much they should take. And then there's also a whole list of terpenes that can be incorporated into our products, and the terpenes are responsible for activities such as inflammation or anti-inflammatories. There's antivirals. Some of the terpenes are good for calming effects, better sleeping, anxiety. So, based on all of these just gorgeous, I think I said that twice now, but just these gorgeous cannabinoids and terpenes and everything that comes to us from the cannabis sativa plant and has been extracted and has been refined and purified. There's a lot of my research goes into making sure that the products that I have developed for our company treat, a specific list of things so that people have a wider range of what they can choose. Perhaps someone just has arthritis, and so they could say, well, I see that the True Fusion is really targeted for people with chronic pain or that have just their back hurts so badly that they can't get to sleep at night, or their feet hurt when they wake in the morning. Or then the list goes on. There's just
Right.
so many interesting ways
Right.
that CBD can help with the body.
And before we move on to the question I had about you developing products for yourself within our company, could you actually clarify what terpenes are? Because I know a lot of people, like when I got started into CBD, I was aware of a lot of the cannabinoids, but the terpene profile was something that I was lacking.
Yeah.
Could you explain what terpenes are for our listeners?
Yeah, so terpenes are naturally occurring substances that have been extracted from the cannabis sativa plant. And they also occur in many other plants and citrus uh, items, lemons, that sort of thing.
Limonene, linalool,
Yeah,
that kind of a thing.
yes. So from lavender, from lemons, from pine, from pepper, just, very common things that we encounter every day of our lives. These substances are not only come from that, but they also are extracted from the cannabis sativa plant too. So I made a little note about actually how many of these substances are out there. Research just this morning says nowadays there are 545 active natural compounds that have been extracted from cannabis sativa. This includes phytocannabinoids, terpenes, um, fatty acids,
Mhm.
simple acids, flavonoids. So it's just really, it's a wonderful knowledge to have, to know that this plant that's been around for thousands of years can bring so much wellness and treat so many different
Mhm.
could assist in treating so many different ailments.
Yeah, and really speaks to why we have products that are whole plant extracts, why we have the whole range, the whole broad spectrum to incorporate that entourage effect
Mhm.
of having all of them together to all work like
Yeah,
that in
yeah.
synchronicity with each other.
Got it.
That one.
Thank you.
Um, yeah, thank you so much for explaining that for us. And
Absolutely.
And also, thank you so much as well for that comment about going to the public library because, um, as we're all learning about these things, like it's so beautiful to hear that we can ourselves go to our free public library and learn about our own holistic wellness, our own
Mhm.
like what can help us with our own ailments, which is seems like what you did with our products. So
Yes.
please tell us how you've developed specifically True Fusion for yourself and how you've also helped me develop or bolster my formula with our Golden Bee Hemp.
Absolutely. So when back in 2017, like I mentioned, my friend brought me her product to take a look at. And, I think it was, we met for lunch one day and I said, be sure to bring that bottle of your product. I really want to take a close look at it. So I did. And
Okay.
I calculated the volume of product in her bottle and the milligrams that were associated inside the bottle, so the content of the milligrams per 30 mLs. I looked at it and I knew that just in the small bit of research that I had done way back then, I knew that there could be a product that could be better. So that is exactly what I did when we were developing our True Fusion, the True Bliss, True Wellness, which was our lotion was the flagship products that we
Mhm.
had to begin with. Also the natural pet oil, which was the founding product. um, but when we went to the human line of developing products, that's when our owner and founder of the company, Clint, he came to me and he said, I'm embarking on this journey and this company, and I really I'm so excited about it. I know you're a pharmacist, and would you have any interest in helping us really develop products and bring a whole human line? We already have pet products, um, as our baseline product, but he said he really wanted to
Mhm.
expand. So I just absolutely accepted the challenge. Like, I've already been doing this research. I have a friend of mine that it has helped so tremendously. Absolutely. So I dug in. I did the research, the milligrams that I needed to achieve the dosage that would be appropriate for treating chronic pain like I had in myself and my arthritis and various other pains that have been bestowed upon me after 30 years of standing on your feet, and
Mhm.
also genetic issues too from arthritis. But so the way that I developed fusion, true fusion, was to make sure that there were what at the time the maximum amount of milligrams per 30 mLs that we could make. And it was actually back then it was a struggle to find the raw product. Um, at the lab that we were working with at the time and continue to work with today, they're fabulous there. They're so knowledgeable. The scientist over there that I work closely with he's amazing. And I said, this is the recipe that I think would be the very best for people with issues such as mine that need to sleep at night or that need to feel well, or just the anti-inflammatory effect of the CBD. And
Mhm.
so I gave them the formula. I gave them the list of terpenes that I wanted in it. Um, we had already used the MCT oil as our carrier base in some of our pet products. So that was already, um, for those who don't know, the MCT is medium chain triglyceride oil, which is very nutritious for the body in the aspect of bringing the fatty acids,
Mhm.
the fatty acids that are so, just rich for the body. So
Mhm. Anti-inflammatory in themselves
absolutely.
when in correct balance. Yes.
Yeah. So I developed that product, True Fusion, and that's one of my claims to fame that I like to tell people that when we hold events, like we did a few weeks ago, Rylee, I
Yeah.
love to tell people, I said, this is the product I developed for myself. So, and I really truly believe in it. But and then just to follow after that, the True Bliss, that I wanted that to be for people that maybe weren't in the shape that I was in. Maybe they don't have chronic pain, but they want it for that anxiety that they have every day, or that they're just feeling like overwhelmed in life, or just, having different issues that keep them just a debilitating anxiety, from enjoying their life. I put a specific number of milligrams of the CBD in that formula, along with a list of terpenes that would also bring calmness and anti-anxiety and just a feeling of just health, just really,
Mm,
health and
mental
wellness,
focus.
mental focus. Yeah, the
I've seen that
clarity.
a lot in our reviews. A lot of people
Yeah.
say that about our bliss is it just gives them like that feeling of coming back to their body and being just blissful.
hmm It's so important. And I think the more people really dig in and understand and educate themselves about what CBD is doing for them, I truly believe that they'll really have a better understanding of why. I know for sure I can speak to myself and the dedication that I've put into developing these products. I really want them to reach as many people as possible and
Mm.
for them to just experience the sense of wellness that they get and that can be achieved. And, you know,
Do you
I'll go
think that
on.
yeah, I was gonna say our wellness product, do you think that's a good introductory product for someone that's looking to try CBD?
Yeah, I do. It's wellness is our lowest strength product with it has 750 milligrams of CBD per 30 mLs. So that might seem like, oh, that's a lot of CBD, but no, it's actually not. It's our introductory um, solution, the
Mhm,
oil that we have. People that use that maybe just want to, have a little bit better night's sleep,
mm,
or maybe they're perfectly fine and they just said, but my friend takes CBD and I
mm,
just want to give it a try. I want to see,
mhm.
I want to experience for myself what they're actually talking about. So I would encourage wellness for anyone that just really wants to have a better understanding of what CBD can do for them. So,
Right, and as I've learned in my research about CBD, and you've definitely helped me with this, sending me all these really great articles, is that CBD just really works to balance your body out within homeostasis. It just kind of gets you
right.
back to that normalcy of just normal wellness when your body is in complete wellness and balanced in every sort of situation. And I think that
Mhm.
relates back to the receptors that you were talking about, how many receptors we really have in our body
Yeah,
for this product, for the CBD, this
yeah.
chemical.
There's such a network in our body, the endocannabinoid system, that is really so fascinating.
Mm,
And, that's what I hope with education and having these talks, that people will be more intrigued, and also I think we spoke about maybe even tailoring some of our CBD podcasts for people that have really specific questions and want to talk about a specific area that they
mm.
might need help in treating, or anything like that. So I'm excited to tell anyone who wants to listen about the endocannabinoid system.
I know it's so beautiful. And I love, like, so far with these podcasts, I've been loving hearing how people use our products and what benefits they're receiving from them.
Yeah.
Um, for instance, I had recently spoken to somebody who was saying that they use our Golden Bee Hemp Pain Salve for neuropathy in their feet. And that just blew my mind. I was like, "Oh, I never thought about that." And they were just saying how wonderful it is for them. So I was hoping you could also speak on how you've developed help me bolster my formula for Golden Bee Hemp Pain Salve, and the terpene profile that you used. And also, we haven't touched on True PM nor the True Soothe lotion. So please, since we're going through all the products.
Yes, absolutely. So your product was gorgeous to begin with.
Thank
Just
you.
the lemongrass, the fresh scent, the feel of the product on the skin. I just knew that it was just such a wonderful product. But I saw an opportunity to really, really take it over the top. And
Mhm.
that's how I suggested we use the 1,000 milligrams of CBD, really bolster it up. And, the terpene profile that we put in your salve was to help people with their pain relief. And exactly, as your product describes, it's a pain salve. It's going to help people with that terrible achy back after a long day's work, or oh, I've been in my garden for the last 5 hours. Now my, hips are hurting or whatever. Your product has helped me on so many different occasions too. A long day, or walking around, or just been on my feet so long. I can rub that on my back and actually massage it in. And truly, within 20 to 30 minutes, I feel more at ease, more at peace. It's just I don't have the anxiety from that pain that I'm experiencing. And I just love it. Rylee, I'm so happy for you that your salve is just really taken off and able to help so many people now.
I'm happy for
Yeah.
us. Without you, it wouldn't be this bolstered product. We wouldn't be able to do this all together and have all
It's
these
my
products have this broad spectrum of cannabinoids, and your formulation of like specifically selected organic terpenes and the flavonoids,
Mhm.
the fatty acids, and all those beautiful things that you were just talking about. So I'm
Yeah.
excited for us. I'm excited for what we can do for the world.
Yeah.
I'm seeing like personally how it's helping you so much with I actually also wanted to ask you about how like your dosage of fusion, but let's get through the rest of the products first.
Sure.
Okay.
Yeah, dosages are a really great topic to bring up, because that's another area where people are just so shy
Mm,
on dosing CBD, and then they don't end up using enough of it for what they're really seeking it to help them with. And so they give up on it quickly, or they say, oh, gosh, it really just didn't even help. So I don't know why I'm
mhm.
taking it. But when we come to that section of our podcast, I want to shine some light for people and really help them understand how to truly use it. But just yeah, let's talk about the True PM.
Okay.
I there's a specific cannabinoid called CBN, uh, cannabidi no, so
Nile.
thank you. I know, I was
Cannabinile. It's okay. These words are
so
so long, and I get when you're reading them, it's like okay,
I
you just
know.
skip it after a while. You're like, got
My
it.
my eyes got a little crossed. Anyway,
Yeah.
so we did a lot of research and looking into this cannabidiol
Hmm.
and the CBN, and how it was deemed the sleepy cannabinoid.
Hmm.
And so Clint and I started talking about, let's really launch a product for people to help them sleep, because sleep deprivation is one of the
Hmm.
most probably debilitating uh, ailments that are out there. There are so many different reasons why people don't sleep at night. It could be from stress, or just, a woman going through menopause, hormonal changes. It
Hmm.
could be many different things why they don't sleep. So we really wanted to fortify this product and really bring it into light and have it help so many people. So I did quite a bit of research on CBN and the combination and ratio in which it should be formulated with CBD. So there's a particular ratio that you have to target. And so we brought that with the help of the lab, and in my formula, we brought it together in combination with also melatonin. And so it is a combination of the CBD, CBG, and CBN
Hmm.
plus melatonin.
Hmm.
So it, as you mentioned, the entourage effect of the cannabinoids plus the different terpenes that are in there, the addition of the melatonin,
Hmm.
um, it's just such a wonderful product. There's there's so many people that it has helped.
Mm.
And I've taken it myself. It really, I take 2 droppers full of it, and it just really helps so very well. Such a nice night of sleep. It's
Every night you
really,
take that?
no, not every night.
Okay.
I don't, luckily, I don't need it every night, but when I
Mm.
do, when I'm facing, or if I have to, be somewhere very important the next day, let's say,
Mm.
let's, I know that I want that good night's sleep so I can
Mhm.
continue and be strong for the next day. So
Right.
that's when I do use it. And it has a great flavor. We haven't even touched on the flavors of
I
our products
know.
yet
The flavor
either.
is really nice. The flavor is really nice.
Yeah.
I love the flavor of that one, actually. That one
Mhm.
has like that kind of like berry-ish flavor, and that one,
Mhm.
for me, that's really delicious. But anyway,
Yeah.
we can get there too.
Yes. Yeah, we should actually say just a bit about our products, how cleanly tasting they are. There's no grassy tasting.
Mhm.
There's no bitter.
Mhm.
It's a very pure and clean formula, very natural, well, all natural ingredients, no
Yeah,
synthetic.
even the flavoring is natural flavoring as well.
Yes, absolutely. So it's a very good product, a very good
Mhm.
tasting product.
Yeah, and it has to do with our extraction methods as well, because we don't a lot of companies are using these isolates, which are like chemically laden, they're stripped, they removed all the yummy things from the plant, and we
Mhm.
just don't do that. We believe in, holistic plant. So
Yes,
thank you for
yes.
touching on that.
Oh,
Um,
absolutely.
and I guess while we're on the topic, the fusion, the cinnamon, it's actually delicious. I just wanted to compliment you when you were developing that. It's not like a spicy cinnamon, it's like a sweet cinnamon, and it's delicious, which I'm sure you know as you take it every day. Um,
I do.
you're
I do.
welcome.
I enjoy it very much. It's something when specifically, and that I'll also tell our listeners that the way to properly take your dosage of CBD is to hold it under your tongue for 60 to 90 seconds.
Mm,
And you're thinking, wow, that's a long time. But really, you can busy yourself doing,
mm,
something else for that 60 to 90 seconds. But my point being is that if you have to endure something under the pocket of your tongue for that long of a period of time, you want it to taste good.
mm.
You do not want it to be bitter or grassy
Mhm,
or just anything. So
mhm.
that's really important too.
Definitely. And
Yeah.
I've tried our products even without the flavoring, and they're actually delicious. I know a lot of companies, they put flavoring in their products because they're trying to hide the chemical taste. But for us, the underneath all of the flavoring, like it's still delicious. I think
Yeah.
for us, why we've added the flavoring, and get me and correct me if I'm wrong, is because some of the terpenes end up tasting a little like some of like the pinene or the linalool or the sharp like lemon, limonene, anything like that. It can end up being a little bit bitter or something like that. So I just wanted to
Yes.
clarify that we're not trying to hide anything. We're just trying to complement the natural flavor profile of these
Compliment.
natural
Yeah.
extracts.
Yes. And also when we were naming the products, the flavor also had a part to it.
Mm,
Wellness is our minty flavor. Our True Bliss is a nice berry flavor, really
mm,
calming. Our
mm,
True Fusion is cinnamon,
mhm,
sweet cinnamon and natural. We put a lot of thought into it actually. I told Clint, I said, I want the True Fusion to have really something to say. And that's why we chose the cinnamon flavoring, just so that people knew that what they were consuming was, really the top end
yeah,
of the
it's not
product.
playing around, it is
That's right.
there. So tell us about your dosage for True Fusion, because I know you take,
Yeah,
a fair amount every day.
I do. I actually shock some people when I tell them what my dosage is. But first, let me re-refer to the FD. I know, I'm wondering if that's a word too,
I don't
but
know. Maybe it's just refer.
yeah, refer back to our product Epidiolex, the
Mm-hmm.
FDA prescription strength cannabidiol product.
Mm-hmm.
So within that package literature, it does state that the safe dosage is 20 milligrams per kilogram per day. So if you can do a quick, like mathematics, let's say a 100-pound person might be, they would be 50 some kilograms. So it would be 50 some kilograms times 20. And you're already at 1,000 milligrams per day. And that is, that's deemed by the FDA as a safe dosage. And, it varies upon weight.
Mm-hmm.
So my point in saying that the safe FDA product says that this dosage is safe, I target when I target that sort of dosage for people with varying ailments. So
Mm-hmm.
let's say me, I'm a little bit more than 100 pounds, but my dosage could actually be more so like 1,400 milligrams a day. So, but it's not feasible to take that much. So I divide that by 3, and I take about 400 milligrams a day. So,
Wow.
and on bad days, I'll actually repeat that 400 milligram dosage for the nighttime as well. So
Mm-hmm.
when I take it is in the morning, and it really just brings me that sense of relief. I
Mm-hmm.
can tell that I'll be able to walk around and not be hurting, not struggle. So my dosage is 400 milligrams a day. I do that every day. But
It's
my
beautiful.
safe dosage can go all the way up to 1,400 and probably even more than that. So
Wow.
that that's what I wanted to touch on too, is a little bit that people don't realize that the amount of CBD that it is effective for them could actually be way more than what they have already calculated in their mind. They
Mm-hmm.
might say, oh gosh, I better just start out with 10 milligrams of it because 10 milligrams seems like a lot. And I'm like, oh no, 10 milligrams would not help you at all. Perhaps it would, but if you had someone with real anxiety, you
Mm-hmm.
would really want to
Mm-hmm.
aggressively dose that person because you don't want them to be in an anxious state. You don't
Right.
want them to have to suffer with, what's going on with them.
Mm-hmm.
So that's my experience with calculating dosages that really have an impact.
Yeah, I know we do we recommend personally on our team that we recommend having these dosage of the oils, but then we also sell our gummies as a way to just kind of like re-up during the day to have them conveniently in your bag, individually packed to just be like, okay, pop 10 milligrams. Okay, I need 20 milligrams, however many gummies
Mhm,
you think could just bolster so that you don't have to keep your oil on you. Because again, these oils are naturally and specifically formulated to be out of the sun, to be, it's best to keep them at home. So having
mhm,
these gummies to take along with you, and on our page, they're called our natural gems, to just pop whenever you need them, like have them at your
mhm,
desk, at work. Um,
mhm,
and something I've also heard from Lisa on our team, she was saying that she was taking I think she was taking our bliss, but once she's found out that what you're saying, that her dosage wasn't high enough, she said she really started feeling the effects, really started seeing the benefits. So
yeah,
I definitely think there's something to be said about what you're saying about people not dosing fully, like, oh, I'm afraid, or I don't know how it's going to
mhm,
react in my body. But just
mhm,
knowing that it's a natural substance and you can't overdose, and your body we naturally make these endocannabinoids, like in our body we make endocannabinoids. And so we bolster with these phytocannabinoids when our body doesn't produce enough of these cannabinoids to maintain that proper balance of homeostasis.
That's
So,
so well put, Rylee. Thank you for bringing that to light.
of course.
Yeah, our True Gems, the gummies, that's a perfect way just to, and it's so easy storage too, just easy to carry with you when you need them.
Yeah, definitely. And even for like as you said, this endocannabinoid system, it's in all mammals. So that's something that our natural pet oil does as well. We have 4 products now, and we do have some things in the works, some more things that we are developing with our natural pet oil and our true natural oils, but we won't spoil anything.
Yeah.
But
Give a little
yeah,
teaser on what we're working with, what
yeah,
we're working
and
on.
yeah, and maybe a little bit of skincare as well, but shh, don't tell nobody.
Yeah.
um, anyway, yeah, I just wanted to talk about how this cannabinoid system it's in all mammals as well. So that's when you're
Yes.
speaking on all this, we're also applying the same things to all domestic animals, dogs, cats, horses, ferrets. Like we've helped so many different types of animals, rabbits
Mhm.
as well with our natural oils, natural pet oil product as well.
Uh, I have a meeting tomorrow. Actually, we're just going to be at the same event, but she's already sent me a message about talking about a dosage for her horse.
Wow,
So I'm excited to talk with her about that and to help her. You know,
that's
you
beautiful.
know. Yeah.
Yeah, I've heard so many stories that Clint was telling me about some ferrets that we've helped as well, and it's
Mhm.
just gorgeous. I think
And
that, go ahead.
And also, I was just going to add that, people have come to us too with very ailing and aged, um,
Mhm.
pets that might have a diagnosis of cancer or a tumor. And I think even some reviews on our website just say, oh, I'm so glad that we started them on natural pet oil because it really
Mm,
extended their life and they seemed more comfortable and at peace.
mm,
Or, for some of the dogs that we sponsor the team, or our team Natural Pet Oil, we sponsor
right,
athlete dogs, and just to hear the stories about how it helps their joints or after
mm,
a big event that they've jumped,
right.
diving all day. And, doggies get sore too. So they need help and they need the anti-inflammatory effects from our natural pet oil products. So I really feel like we're just helping just literally a full spectrum of people, pets, just all living things. So,
We really are. I love hearing these stories, and
mhm,
I've definitely heard that from talking to these people about their journeys with Natural Oils Inc. That yeah, it's helped a lot of like you said, aged dogs
mhm,
live out the rest of their life very comfortably, and maybe give them
yeah,
a little bit more energy to just feel the
mhm,
love from their owner and their family. Um,
and how beautiful that is.
I know.
Yeah.
Honestly, it is really, really beautiful. I'm so honored to be part of this company with you and Clint and the rest of our team.
It's a pleasure to bring these products and develop them and, really see the results. It is just truly such a pleasure. It's a culminating, um, well-rounded journey in my career, very lengthy career. So now I can say I've done this, and hopefully those around me can say that I've done it well. So.
I believe you've done a great job. You were working on our blog for a long time, and now I'm just kind of recirculating some of the research that you've put into our blog, and the just the sheer amount of information and education that you're bringing to the world is just so gorgeous. And
Thank you.
with these products,
Well, thank you for all that you're doing now with our website and, just getting the message out there, asking leading questions that, gets people to think, and just be more curious about CBD and how it's helping everyone. And
Yeah.
I really have the hope that one day people will just be so educated, on these products. Yeah.
I agree. And I have a lot of hope for the future of CBD and all the cannabinoids. Um, I would like to talk about what we're going to work on next, but I don't want to give any spoilers. Um, so, um, what can we tell them about our stuff that we're working on?
So, well, let's just launch into the topic of CBD and how it affects our skin. So, there's an entire oh my goodness, there's an entire just list of ways that it can help our skin from the inside and from the outside, which is, of course, topical skincare. It helps with all sorts of skin ailments, not only just acne. I mean, there's many different skin disorders that people
Mm,
struggle with on a daily basis. And gosh, if they just knew that there was a product that could help them, or that could, you know, get them to get to the other side of, a
mm,
breakout or an eruption of psoriasis, or,
mhm,
a contact dermatitis issue.
mhm.
Um, I think that that's really worth delving into. So I'm excited about our next venture without giving any spoilers, like you mentioned. So our
Definitely.
listeners will have to stay tuned to see what is coming down the line.
Definitely. And I'm excited to also educate people on CBG because CBG is so gorgeous for the skin, and it's something that we're incorporating a lot into
Mhm.
our next venture for the skin. I realized that we actually haven't touched on True Soothe lotion. So since we're on the topic of topicals, could you speak on the CB1, CB2 receptors, and the True Soothe lotion, please?
Yes. Yeah, absolutely. So the endocannabinoid system, again, is made up of many receptors, primarily CB1 receptors. Think of CB1 receptors as basically our central nervous system. So the brain, the basal ganglia, the hippocampus, the thymus. CB2 receptors are in all of the peripheral tissue.
Mm,
So all of the periphery, the organs, such as like the skin as being the largest organ of our body,
mm,
CB2 receptors. Our immune system is has high affinity for CB2 receptors. Our lymphocytes, our T cells, things like that. The topical lotion that we developed was specifically manufactured for aches, for muscle tension, for just a topical neuropathy, like you
mm,
mentioned.
mhm,
It helps to, say, if you have carpal tunnel, it can help your wrist if you rub it there. We have one of our very dear friends that uses it. She has MS,
mm,
multiple sclerosis, and she swears by it. She just said that this is the best product that she's ever made, or that she's ever come across, that it helps her so much with the tingling and the numbness of her hands. I feel so good. And she's such a dear friend of ours too. It brings me joy to help her in that arena. So,
mm. Brings me so much joy as well to see what we're doing. And that's my
mm,
goal with these podcasts. I would love to keep talking to all these people about their journeys with CBD and our products and how they
mhm,
incorporate all the products for their family. Like I've been talking to a lot of people who use it for their dogs and use it for themselves. And at the end of the day, they'll rub in the CBD pain salve for Golden Bee Hemp into their feet. And
mhm.
yeah,
Really
I,
wonderful.
I love it. And continue the education as well, and as well as our blogs. And yeah, just if I wanted to mention that if anyone wants to read any more about what Robin has written, to head over to our blogs. We will continue with these podcasts. And I just hope that we can just continue the education and breaking that stereotype that people have around all the cannabinoids.
Yeah, I think that we should mention how to really get a whole list of our information on both of our websites.
Mm.
So if you were to, well, I'll let you take it away, Rylee.
Right. Okay. So truenaturaloils.com is our full range of products that will have our pet oil products, that will have our golden bee hemp product for pain, that will have our human oils, our gummies, our lotion, that will have all of them. Naturalpetoil.com is going to be just our pet products. So that's where we sponsor a lot of our dog athletes, like we've talked about, our team NPO, as we like to call it. We have a whole team of people using our natural pet oil products. But for a whole range of all of our products, truenaturaloils.com would be the best place to find us. And yeah, just subscribe to our podcast, keep listening, keep hearing our reviews. If you're curious about education, read our blogs and subscribe.
Yeah, come and see us on Let's Talk About CBD.
Yeah. And also, if you have any questions, like Robin was mentioning, if you have any questions about like, oh, I have this ailment, could CBD help me? Or how much CBD should I be taking? Or just anything. Like we love talking about this, clearly.
Yes.
um,
I believe our listeners could send an email to info@truenaturaloils.com, and that email will be forwarded to me where I can answer questions. So please, I encourage you to use that.
Beautiful. Well, thank you so much, Robin. I think we've covered so much and given our listeners a really good base of what they need to know about the endocannabinoid system and how CBD could help them. So
Thank you for inviting me today, Rylee. It's been such a pleasure just speaking with you.
I've loved it. You're such a joy, Robin.
You are too.
Oh, well, I'll let you go. Have a beautiful rest of your day, and I hope we can do this again in the future, and I'll see you at the next event.
Sounds great. Take care.
All right. Have a good rest of your day. Bye, Robin.
Bye.